Yeah, this it'll pick up anywhere I'm being.
Does that work? Is it on? Can you hear me okay? Yeah. Okay. While I'm speaking, I have RAT cards from social services that you're welcome to take. I wanted to start first. Thank you for having me. My name is Jessica Strong. I'm the social services manager for the County of Los Alamos, which means I work for the county government. There is a community services department, along with some of the other big departments, public utilities, Department of Public Works. The community services includes the parks, the recreation departments, the libraries, the art and public places, and me and my staff, social services. I also oversee the county health council. And for both of those entities, we always hear like, that's great. I have no idea what you do at social services, or I had no idea we had a health council. And I love talking about my job. I love the work that we do. And I'm always so grateful for the opportunity to come and share with everyone about it. I moved here almost 6 years ago during the pandemic. My in-laws have lived here for a number of years, retired from the lab. We lived in Pittsburgh. My kids came out here for summer vacations. They did the peak summer camps. We did the New Year's Day event at the library with the balloon drop at the library because we were out here for Christmas every year. And
Are you a Steelers fan?
Technically no, because I'm actually from Ohio, so I'm actually a Bengals fan, which is like almost worse. But because I like losing teams, I'm also a Pirates fan. So, I split my loyalties. Great question though. But we just kept dreaming of moving out here. But, like life was there. My husband was a chef. He had a restaurant. I worked in behavioral mental health and substance use in Pittsburgh. And then the pandemic happened. And I'm very close to my mother-in-law. I wanted to be out here to help her, during the pandemic when we were still like washing boxes and like we weren't sure where the pandemic was going to go. I am a total doom and gloom person. And at one point at the beginning of the pandemic, I was crying to my husband that I didn't want to die in Pittsburgh. And he is an optimist. And he was like, I was like, this is the Black Plague and it's going to go on forever. And, I don't want to die in Pittsburgh, which was very dramatic. And he was like, I don't think you're going to die in Pittsburgh, but okay. So we ended up selling our house and moving out here. And it has just been wonderful. I have a son who is finishing freshman year at college in Spain, studying tourism and hospitality at a program in Spain. I have a son who's finishing sophomore year. In 10 minutes, his first day of finals will be done. And then I have a 5th grader at Mountain. So that's me. And now about social services. The first half of the presentation is about social services, and then the second half is about the health council. There's a lot of overlap. Do we go till 1? Okay, so hopefully there's time for questions, but by all means, if something's not clear, let me know. This is our entire team. We have 6 full-time staff and 1 part-time staff. When I started, I was the 3rd person, so there really were just 2 folks, Aloysa and Denny, and if you are familiar with social services, you may have interacted with either of them. In the past 3 years since I've been here, we've been able to grow quite a bit based on looking at the data and seeing that there's a really both more needs than we were expecting, and also people who maybe have not yet interacted with the government. And if you have interacted with social services, a lot of the work that we do that I'll get to here in a second is more than what we can solve in 45 minutes. I wish that were the case, but it isn't. And so we've been able to grow. We now have a part-time mobile homeless specialist who is able to go out and meet with people in town who are experiencing hardships. Usually the question I get there is, do we have homeless people in town? Like, we don't have a bridge where people are congregating, or, like an encampment. But when we wrote the grant to get this position funded, we conservatively estimated between 60 and 70 or 80 people experiencing the entire spectrum of homelessness, whether they are couch surfing, or staying with friends, living in a basement or a casita, to living in cars and RVs, to true kind of rough shelter, living in tents usually moving along in the forest lands. At any given time, we are helping, I would say, 12 to 15 or 16 people. We have a number of success stories that I would be happy to chat about. I don't know that I can make it to Thursday nights, Beef and Leaf, although I love that place. But we've been able to move some people into housing. Affordable housing remains one of the biggest challenges, of course. But we have a number of other folks. And so just a very, very simplified graphic, what we do. Kind of our top activities are up here. We really help individuals and families in need. And I left that as broad as possible because we get calls from people who are worried about paying their utility bills, have been evicted and don't know where to go. Did not know that we have a food pantry, LA Cares, in town, and they don't know where to go to afford groceries. We've gotten calls about where to get their pets spayed or neutered. We have received calls about worried about a neighbor who has been living in the shed on their property with an extension cord running out, and they didn't feel that was safe. And we were like, absolutely, that is not an ideal way for someone to live. We get calls from people all of the time. We get calls from the resource officers and counselors at the schools worried about families. We get calls from the hospital when they are discharging a patient from a routine medical event that the person mentioned. They don't have access to heat in their house, or they don't have access to food, or they don't feel safe with the person who's going to come and pick them up. The gamut is really, really wide, and our case coordination specialists are just amazing encyclopedias of all kinds of resources in our county, in Arriba and Santa Fe, in Albuquerque, kind of in the entire, like in Colorado, and we've had to tap into resources in Phoenix as well. We also oversee a number of community contracts. I believe it's around 40. I should know that specifically, but we'll say it's around 40. Contracts that the county has provided to maintain a quality of life that we enjoy in Los Alamos. I oversee the contracts for the senior center, for example, both Betty Earhart and the one in White Rock. And that includes transportation to medical appointments. That includes provision of meals, whether that is on site at those places or meal delivery for people who are homebound and their caregivers, and to prevent social isolation. So contracts for the different clubs and activities that happen. I oversee the contract for the youth activity centers, again, in Los Alamos and White Rock, as well as the teen center, to keep kids entertained, to provide a service for working families. There are other contracts in there related to mental health, related to support groups that take place at Family Strengths Network, ones related to kids' emotional and behavioral support needs at Las Cumbres and JJAB, the Juvenile Justice Advisory Board. We do use a lot of acronyms, so if I drop an acronym and you don't know what it means, let me know, because we joke about acronym soup all the time. So we oversee those. That's a way that the county is providing those services that run through social services. We work a lot to address the social determinants of health, that orange box on there, because really in the big picture, all of these things are related. Housing and your physical health and your mental health and your ability to have meaningful social relationships, your access to good quality, affordable food, these things are all related, right? If you are lacking in one or more of those, it is going to impact all of the others. So I have been really, really fortunate to be involved in some of the affordable housing work that is happening in the county, with the homelessness work that is happening in the region and the state. Some conversations about transportation, particularly as it relates to emergency vehicles or the EMTs, and how those decisions get made on a regional health basis. There's a lot under that umbrella, for sure. In 2019, the county formalized the County Health Council. The state has an alliance of health councils and has recommended there be a kind of volunteer-led, grassroots-led health council in each county. So we are part of the statewide allowance. It is an official part of the boards and commissions of the county and kind of subject to all those same rules, publicly noticing meetings and minutes and agendas and stuff like that. And I'll get to the health council here in a couple more slides. And then increasingly, we are doing a lot more with regional and state partnerships because none of this happens in a silo just within our county borders, right? People travel for their medical needs. People live in Espanola and drive up here for work or get their medical care at Lovelace. And, like all of these things are connected. And so in the past 3 years, I can't speak to how any of it operated in a silo before, but the state is really doing a lot in a regional capacity. Part of that, you'll see, I have it on a couple of other slides, is a statewide investment in regional mental health and substance use needs. Our region is Los Alamos, Santa Fe, and Arriba counties, and the 7 tribal nations within this. It's considered Judicial District 1, if you want to get really super nerdy about it. I am happy to meet for coffee or lunch at any time. If you want to nerd out on this, I always joke coffee is my love language. I will chat about this for much more than 20 minutes. So please, James knows this, I'm happy to meet at any time and talk about it in more detail. But the idea being that if we, instead of having one state mental hospital in Las Vegas or one youth mental health place down in Santa Teresa down in the southern part of the state, that we would build regional hubs and make it that much easier for people who need detox or sober living facilities or mental health supports, particularly after a mental health crisis. We're trying to build it regionally. Much, much, much more to come on that in the future, not in this presentation. So what I like to tell people who ask, like, what does social services even do? We are not crisis services per se. We are not 24/7, but we're a really, really good first door. We have people who are familiar with so many of the resources that might be needed, and we do it in a way that is based on the goal of the person coming in. We always recognize the individual that has the autonomy for their own decision making and let them kind of guide the process. And we try to do it in a trauma-informed way. We don't ask people to, we try to collect, if there's a hardship happening, we try to collect that information once. And then we have a shared software system with other providers in town so somebody doesn't have to keep repeating a terrible story. We try to help kind of smooth things out. If a person comes in who, for example, may be living in their car, but their first thing that they're asking us about is help locating their GED paperwork so that they can apply for jobs, like that's where we start, right? We often can brainstorm things that the person maybe hasn't thought about. I will give, a very quick example. There are not very many medical providers in Los Alamos who accept Medicaid. So we've been working to expand the video and telehealth capabilities, both for medical and for mental health services, right? Because a lot more may accept Medicaid as payment that are on telehealth are not located in the county to make sure somebody can get that material or that information. I like to talk about social services as part of a safety net, right? That's a metaphor that people use a lot. But if you've heard me speak before, that image means there are holes, right? A net has holes and people we know fall through. We sometimes talk in our office that the minute they walk in the door, that is our best opportunity to help, because once they leave, we may not see them again, or it may be 6 months, or it might be 3 years before we see them again. And I spend a lot of time looking for ways to tighten that net, make those holes smaller so that people don't fall through. In the couple of years that I've been here, we've built really, really good collaboration with the police department, with the courts, with the public schools. Los Alamos Public Schools now has 2 prevention specialists. with a lot of our contracted providers, both in this county and then again in the region. We don't have a domestic violence organization solely dedicated to domestic or interpersonal violence, but we have very good relationships with both the Crisis Center in Espanola and Esperanza Shelter in Santa Fe, and also with the teen shelter that's in Santa Fe. So Esperanza Shelter, in fact, comes up to Los Alamos twice a month to meet with people one-on-one so that people don't have to don't have to go to Santa Fe to get their advocacy and free legal services. We've also worked to expand our harm reduction efforts. We have about a dozen places where Narcan is available for free. Naloxone, which is a opioid, it can reduce or reverse the effects of an opioid overdose. So you can now get Narcan for free at both libraries, Mesa and White Rock, at both visitor centers, at the co-working space in the square there. I'm just randomly pointing. I don't even know if that's the right direction. But we've also worked to train the county streets and facilities and bus drivers so that Narcan is also available there. If they happen to be out doing utility work or road work and something happens, they are also equipped. So that number is out of date. There's now closer to 40 contracts, everyone from young children and families to older adults. I kind of already went over this. I also oversee 6 facilities. So 2 senior centers, the teen center, Las Clinicas del Norte, which functions as the sliding scale or low income health clinic in Los Alamos. It is located right across from the high school and provides free or low cost STD testing, pregnancy testing, vaccinations, and a couple of other things. And then the 2 youth activity centers. Here's a little bit more about those social determinants of health, kind of where we see gaps or needs in our county, but also in the wider regional community. Addressing homelessness and even expanding that, just housing instability in general. In the past year, or I would say 2 years, we've seen an increase in the number of people over 60 coming in for social services because their rent has been increasing faster than their ability to cover that increase. They are on fixed income or are having difficulty making those rent payments. The Bluff Senior Housing opened on DP Road and has some affordable units, but those filled up immediately. So how do we keep seniors living safely in our community, right? Part of that is also, I didn't put it as a bullet, but there are a couple of us talking about these issues coupled with the kind of increasing climate variability, kind of longer, hotter periods, and kind of the dramatic ice storms or dramatic weather that happens with more frequency, and trying to decide how to address, especially among an older population that is more vulnerable to extended heat waves, how to get some more safety measures in place. And I'm using kind of a very wide waving of my hands here, not even like air quotes, because we're trying to figure out where would we need generators? It can't just be here's some fans, because if the whole power grid goes down, as we saw in Texas, or there have been a number of deaths in Phoenix and Arizona. So trying to look at what could be coming and how do we start putting preventative things into place. Yep.
So with 2 questions, kind of with free legal services, when you're talking about homelessness and stuff like that. I was working with a woman who had her cancer came back, stage 4 cancer. She's about 54, and I realized that her landlord had the right to evict her. Mm-hmm. And so so when you're working with situations like that, so the legal side, how much are you able to do? And then my second question is, do you ever have some things where you just oh, I wish we could just change this and that in this law, and
all the time is my answer to the last one. And I am not being facetious. I mean, we operate within, right now, currently constantly changing federal rules and regulations. There was an issue in September where the agency that oversees substance abuse and mental health, SAMHSA, lost a bunch of its funding. That is where we get SAMHSA sends the state health department, which then sends to the counties, the free Narcan for us to distribute as a proven harm reduction model. That has gone away, but then it came back, but now we heard testing strips have gone away. So we are constantly like, if I could fix a lot of things, it would be some steadiness instead of like kind of constantly changing things that make it hard to navigate. I mean, and I would also like have $1 bazillion, right? To fund social services, not for me, for the system. But for I would say legal assistance can be very hard to come by because of the huge demand. Whether that is calls we've had to make for immigration related services or eviction related services or other, discrimination, whether it's ADA, accommodations, other things. That one is very hard. There's there's also elder law that we have had to use in the past. That one is very, very challenging. Yes. My point that I was making earlier, Esperanza Shelter has legal assistance for people going through domestic violence related situations that we connect people with Esperanza Shelter and then they help take care of that legal part.
Right.
So real quick on the emergency food aid, one of the things we were able to do, the next couple of slides are just photos of kind of us in action at outreach events and education, but it ties in very nicely with your question. In November, the federal government suspended SNAP payments, which is emergency food aid for people who are low income. And it ended up being suspended for 40-ish days. For longer than a month, people missed their payments. And so we worked with LA Cares and the Health Council, a number of congregations and a number of local businesses to put together emergency food bags that had 10 staple items. And we ended up collecting over 2,000 pounds of food. So it was pasta sauce, peanut butter, jelly, crackers, and a couple of other things, like all, kind of standardized items, fruit, vegetables, beans in a bag. And then we put those out at a variety of public places, including the courthouse, the libraries, a couple of other medical providers, so that people that were coming in for any of those things and had lost their SNAP benefits, like you didn't have to come into social services, you could go to any of those places in the community. We are likely going to be doing another round of that next month in June. The libraries in particular had a very, very good response to people coming into the libraries who needed emergency food. And the kids who are in the public schools and receive the free lunches and breakfasts, so the libraries have brought up to us that there's still a need for emergency food aid. So the Health Council will likely be doing another massive drive with LA Cares. All right, so that's one hat, that's social services, not crisis, but really if you don't know who else to call in the county, you can call us and we will answer or figure out. We get a lot of calls that are not for us, but under good customer service, we still want to help. If you put a refrigerator out, for example, and the trash didn't pick it up, you can still call us and we will get you connected to environmental services to make sure that gets picked up. If you have questions about what hours the animal shelter is open, we will help you answer that too. But call us, we're happy to help. The number is on the rack card. If you are concerned about a neighbor or a friend, or you just want to know some general resources, like we really are the right place to call. So under social services and as part of the county structure, there are something like 15 boards and commissions, one of which is the Health Council, which serves to advise county council on a bunch of related health matters. I will put an asterisk here because it does get a little tricky because a lot of health stuff is either individual decisions or related to private businesses. So sometimes there may not be much that a group of 15 volunteers can do besides make give advice to county council, and whether or not council chooses to act on it or decides it's out of the purview of county government, can be the subject of a different taking me out for coffee. That may actually be like after hours. So I tried to show where social services and the health council and then regional work kind of all works together. So social services, that top light peachish orange, we are addressing the local community needs, right? An individual needs help applying for SNAP and Medicaid. A family needs help finding an affordable apartment to stay in. Also under social services, part of my overall budget includes the opioid settlement funds. I'm going to assume most people have followed that Purdue Pharma and other pharmaceutical companies told doctors in the early 2000s that oxycodone and other opioid-based medications were not addictive, and it turns out they are wildly addictive, hence having a national opioid crisis. Those pharmaceutical companies settled at the national level. Money was distributed to states and then to counties. So that's also part of social services purview, is not just the individuals, but kind of addressing system needs as it relates to those funds. The County Health Council is really tasked with carrying out statewide efforts under the New Mexico Department of Health. And we work a lot with the Alliance of Health Councils, with all of the health councils and all the other counties. And so that has been really fascinating, because health councils get to choose what their own priorities are, and I'll get to those on the next slide. And then at the state and regional level, there's what we call Senate Bill 3, but is this Regional Behavioral Health Investment Act. Oh, there's an extra little tail parentheses, little typo. So looking at then how do we take what we are seeing at individuals in the county, right? Access to Medicaid, or what we hear a lot is lack of access to mental health providers or long wait lists. What are other health councils looking at and doing, and then taking it to the regional and state level to build bigger systems across the whole region. So here's a couple of the activities that every one of those different groups are working on. So like I mentioned, mental health, substance use, safe and secure housing. And then we are not crisis, that is how I started this, but we are working to implement a crisis response method in Los Alamos County. I've had numerous conversations with our new fire chief, Litzenberg, with the police chief, with kind of building on those good relationships with police officers. We have some funding, and I have a, James, when you said, I was recently at a conference that was literally how to develop and implement crisis response teams in your county. So I was very fortunate to be a part of developing this in Pittsburgh. Literally 18 years ago, I was pregnant with my son, who is now a freshman in college, but Pittsburgh obviously is much different than a small rural community. Access to medical is different, but the police and EMTs and social services will be working on that, hopefully starting in July. So that's really, really exciting. There's a lot of different models out there, but they've been really, really open to figuring out how we can improve the response if somebody is in need of mental health services or detox or rehab services. So that should be really, really great.
I had a question. So
Yeah.
it says no low barrier to MH. I assume that's mental health.
Yes.
Can you say more about that? Like there's no barriers at the state and regional
No,
levels?
that's what we're trying to work towards.
Oh,
So
I see.
that's the
Okay.
goal, is to reduce barriers to receiving mental health treatment. Yeah, so let me jump to that, because it aligns with where those two things interact, right? If we are building, if we're looking to expand mental health resources in the region, so Santa Fe, for example, is moving forward with a youth behavioral health center to have both just drop-in time, like if if any high schooler wanted to drop in, they just could, but then also build in wraparound services. So there would be mental health counselors on site. To make it a true no or low barrier, like how would high schoolers from Los Alamos get there, right? Like transportation is always a barrier. When we recently had a client who was an adult in our social services office who wanted to go to detox. We have a couple of partners in Espanola, 2 that were willing and had open space available to take a new client. Our EMTs could not cross county lines. EMTs cannot cross county lines to take someone to a detox facility. They can take them to the medical center to be determined to be in medical need, but the client said, I don't like the medical center and I don't want to go there. And so the EMTs were like, well, if you don't want to go, we can't take you. Like, we can't force you into the ambulance. And the guy was very clear. Like, I need alcohol. Like, I know what I need. I have relapsed. Take me to Espanola. And all of us, smart brains in the room were like, but we can't get you there. And I half joked I was going to get like a taxi checkered cap and like drive it myself, like just like honk honk, let's go. Not allowed. But we can build all of these things, but then we run into barriers all the time with actually getting the person to the help that they need. So part of what we have a weekly call that's actually happening right now from 12 to 1 on Tuesdays. So the regional collaboration is addressing how do we lower all of those barriers. I mean, we haven't even talked about insurance and insurance kicking you out for length of stay. I mean, there's like a lot in there. So that's the goal, not what actually is.
I mean, it's a very interesting situation that happens. This cross-jurisdictional conflict. The EMTs can't cross the border. It kind of reminds me. I remember years ago, a police chief was telling me about a situation where there would be a lot of traffic speeding violations in Santa Fe County just as you're approaching Los Alamos.
Mm-hmm.
And the police officers here couldn't do anything about it because that's Santa Fe County.
Mm-hmm.
And so you had people doing 100 miles an hour coming up the hill.
Yeah.
And, obviously they should have a ticket. Shouldn't be doing that. It's unsafe. So what he told me that was very interesting, he says he reached an understanding with Santa Fe County and they deputized the Los Alamos officers so that they did have jurisdiction in Santa Fe County, and now they could start pulling over some.
Right.
So I just begs a question whether we could have a similar kind of arrangement.
And that's part of what we're all trying to work on. I joke that it's like the most complicated Rubik's Cube. Like, you get one thing situated. Okay, we have money to expand beds at the detox center. We've heard there's a wait list. Okay, so now we have physical capacity. Do we have enough staff? Okay, well now part of what we're working on is expanding the ability of regional colleges and community colleges to certify psych nurse practitioners and other mental health staffing. Okay, and then how do we get them there? Because it doesn't make any sense if we have 20 extra beds and no way to transport them. So it's back to, if we built a crisis response, could a certified mental health professional be authorized to drive somebody in a, safe vehicle with a cage separator, bags in the trunk in case there are weapons or drugs in the bag, not accessible, right? So constant.
So the Rubik's Cube thing, and I just want to say I'm already a huge fan of what you guys do, and I've seen so many people scrambling the last couple of years, and so and so's been defunded, and I know you guys are like, how about this person, and they 10 people and stuff like that, and but what we will have to have that lunch, and we're always talking about stuff here, but like when we think about how to actually do this Rubik's Cube.
Yeah.
That's what I've been really interested in. Also taking that Rubik's Cube question, and I was like, this is just some generic, like, here's a budget where all the money comes at the top, like billions of dollars that come into this county, and it all gets split up into these little tiny streams. And so we're always talking about, like, well, if we could argue with these people right here that we need it here, then we would suddenly have the funding for this. Because we could say, like, here's an incredibly expensive problem, a person who brings up a $200,000 medical bill when a $200 clinic visit would have worked and a $30 Uber ride would have worked. So let's, like, go up here, get that money for this.
And so that's like the spread between social services, like individual, and then also what needs to happen at the systems level within the county regulations or within the region for all of those other barriers or, right? So this is what I do. Just very quickly to wrap this up, I know it's like a couple minutes after 1. Last year, the Health Council completed these 3 main projects. We completed the Comprehensive Health Plan, which is available on our website, kind of a every 4 to 5 year look at the major gaps in services, and then where can the county, either social services, health council, or other county departments start to address some of those. If, for example, we can't change the hiring practices at the medical center because they are their own entity, can we bring up mobile health clinics or improve transportation at LARSO to get people to medical appointments elsewhere, right? What can we fix under our purview? We have implemented that closed loop software, which is like a whole nother presentation, but software that lots of our providers have opted into that shares client information confidentially with their release so that they don't have to keep repeating their stories over and over and kind of corrals everything into one central hub. And then expanded community health outreach because we just kept hearing, I had no idea you existed. What we're going to be doing this year is then back to that other little circle for the Health Council, and what the state is asking is to continue to work on harm reduction initiatives. So we have suicide prevention classes happening every month. We are working on additional harm reduction, like the potential harm reduction vending machine that could go in at the county and would have Narcan available, but also things like sunscreen or a mask or hand sanitizer. I mean, public health is much broader than just Narcan. And then also working on this crisis intervention model. Sorry, I keep hitting the microphone. Working on more outreach. And then one of the big things we are working on is both an online and a printed healthcare directory. It was one of the things the Health Council heard a lot, is that a lot of people move into town, don't know where to go for services. Those things change all the time. So having something like the activity guides, like if you're familiar with the like summer activity guide that the Recreation Center puts out, having a healthcare directory that would also then be updated more frequently online. And that's basically what I do in 25 minutes. Any other questions or things I can help answer? Thank you.
So, real quick, I wanted to let Alyssa and Matea get an update on the Interact stuff, and then we can go back to doing questions. That way, it can give you that.
Sure.
So basically, I would have a piece of paper with me today, but my printer stopped working. So I will be reading off my phone. I'm very sorry for that. Basically, first off, thank you for having us here and for allowing our club to continue, because communication is important for the club to continue functioning. That's why we decided to update you today. So throughout the year, Interact members have been actively volunteering to help the community. For example, Meals of Hope, Purple Pinkies Polio, that one's always really popular. And then our homecoming float, that was at the beginning of this year. And then Rotary Interact members are really enthusiastic about serving the community through volunteer opportunities. And we also allow other clubs such as Key Club or National Honor Society to offer like their volunteer opportunities. So then in return, we can promote our volunteer opportunities through them. So it's like a win-win network that we have. And so this year we had 2 semester projects.
So I'll go over them real quick. So our last semester project was Dear Elder. So it was basically like a pen pal project between high schoolers and then mostly ended up being people who go to the Betty E. Hart Center. So we recruited 53 high school students to write and then deliver letters. So we had a lot of letters go out. We didn't have as much that came back from the senior centers, but we did end up with around like 7 who are still like sending letters back and forth. So that's really cool.
That's
And also
awesome.
like a project that can be continued next year. So yeah, and then the other senior centers that we delivered letters to were the Los Alamos Assisted Living, White Rock Senior Center. We sent some down to Espanola at the Beatrice VQ Martinez Senior Center. So yeah, that was a good project last semester. And then this semester, we did a bake sale for UNICEF. So that happened over a week, and it was right outside the teen center. So it was weekdays 4:30 to 6:30, and then we also had one for longer on Saturday where we just sold out all of our other items. So yeah, we were completely sold out, which is great. And we actually had so many people come and buy baked goods that we had to like panic call people and be like, hey, can you make more? Which was really great. And
Yeah, that's a great
so,
problem.
And it was
Good
great that
position to be in.
Yeah.
and it was great that high schoolers were willing to do that and bake more. So that was great. So we raised around $1,160, and also shout out to Rob. He's not here now, but he was there for 5 out of the 6 days, which is like 10 hours. So he really helped us a lot with that bake sale. And then here we have a ton of bottle caps for the benches. So yeah, we just had high schoolers also donate those.
Yeah. And so then we also have board positions. So basically, we held board positions at the beginning of the second semester because almost all of us are current seniors, except for one who's the new president. So basically, we held the positions for like the rest of the year, but the new board was like our mentees, if you could call it that. So for the president, which is who spearheads the club, it was me this year, and then next year it'll transition to Lucia Rudine, who I think you have her email. So I think, yeah. And then the vice president, which assists in any miscellaneous tasks or fills in for the president. This year is John Kang, and the next year it'll be Rafa. The secretary, which keeps board meeting notes during board meetings, this year is Matea, and the next year it'll be Michelle Lowe. And then we have the treasurer, who keeps track of finances and coordinates with the adult clubs who coordinates with Vince. This year is Lucia, who's the incoming president, and the next year it'll be John Fung, who's Matea's little brother. And then the historian and the publicist, which is like an interchangeable name. Basically, what they do is they take pictures and they do advertisements. This year it was Emily Shu, who also has work today, but who couldn't make it. But next year it'll be Natan Svyatsky, who, I mean, like if you see him around, you'll know who Natan is. So, yeah.
And you get why he's the publicist.
Yeah. And then so some reflections or changes for the next year is the first is that we should probably get things done earlier during the semester to reduce stress, because one cause of stress for us was like working with school regulations. So in the past, because I've been doing this for a long time, like we had like rules, but they never really enforced. And then we have new admin at school now, so we have to work around a lot of these rules. So for example, when we were doing the bake sale, originally it was going to be sponsored by the Los Alamos High School Interact Club, but we couldn't do it because there's a bunch of rules about bake sales, so it had to be sponsored by the Rotary Club of Los Alamos so we could get around those rules and actually have the bake sale running. So that's something to keep in mind. And then also we're going to continue asking club members for project ideas. So for example, we decided this year to donate to UNICEF because a lot of club members suggested it when we asked like surveys about what causes they cared about. So we look forward to another really good year with new Interact members. And if you have any questions or concerns, you're always welcome to contact us. And I don't know when my school account email is going to get disabled, but in that case, I'll send my other personal email over to like Rob or something and you can contact. So yeah, that's pretty much it.
Thank you for doing such a tremendous job.
Yeah, thank you for having us.
I mean, I think Interact is really like a bright spot, a shining spot for our club. So we do a lot through Interact. And it's all possible because of the efforts that you've done and the officers and the members of the club have done. So it's really appreciated. I think it's had a tremendous impact. Especially these bake sales. I mean, $1,000 haul in, that's really impressive. So that'll help. And I know in the past you've donated also to, because I am, after all, the treasurer.
Yeah.
So I think I wrote the check at one point for the shelter boxes and other things that you've done. I mean, you've supported some great charities through the work you've done in Interact. So we really appreciate it.
Well, yeah, thank you. I mean, a lot of us really enjoy it, so it's like, yeah, it's a lot of
It's
fun
fun.
for us. Yeah.